Removable appliances are an essential tool in interceptive orthodontics, particularly useful during mixed dentition or periods of active growth. Their purpose is to guide bone and dental development, correcting early skeletal abnormalities, functional malocclusions, and harmful oral habits. Unlike fixed appliances, they can be removed, which provides flexibility but requires high patient compliance. Their main indications include crossbites, mild crowding, transverse discrepancies, space maintenance, and habit control such as finger sucking. They work by applying light, continuous forces that promote changes in the alveolar bone and dental movement, and in certain cases incorporate functional components that take advantage of the patient's musculature to influence mandibular or maxillary growth. The most commonly used types include active plates, expanders, retainers, and functional appliances, each designed for specific clinical needs using elements such as expansion screws, springs, acrylic components, and retention hooks. Their success depends on correct design, precise adjustments, force control, and proper device hygiene. Biomechanically, they generate controlled pressures that allow bone remodeling, although with less precision than fixed appliances, which is why they are usually employed in early phases or as a complement to broader treatments. Clinical success requires careful planning, periodic checkups to activate or modify the device, and patient education on use and maintenance. Removable appliances represent an effective, accessible, and minimally invasive alternative for correcting orthodontic problems during key developmental stages, achieving functional and aesthetic improvements with minimal discomfort.